Hi everyone. I wanted to take this opportunity just to update you on the work we've been doing here at ICN in response to coronavirus. From the beginning of the year, the virus has moved absolutely to the centre of our work. It's become the priority for us. We've been working very, very closely with the associations in those countries that have been worst affected to date. But of course, what we're now seeing is that this is an issue for all of us worldwide. And I know for all of you, it will be at the centre of your plans and your priorities. We've worked really closely with WHO to bring forward guidance on a whole range of issues, infection prevention, control, wearing of masks, mental health, older people, for example. We've been sharing and disseminating that guidance widely, and we've also been reinforcing the importance of global solidarity and coordination. We know that the virus doesn't see lines on a map, and in our response to it as nurses, as health professionals, we need to work collaboratively together in our countries, but right across the world as well. An area of real particular concern has been to ensure that nurses and health workers are getting the support and the protection that they need. Very early on in February, we called out the lack of supply of personal protective equipment. I managed to talk to Dr. Tedros about that, as did our president. WHO have made some strong comments. The situation has started to improve, but not quickly enough. There is still a shortage in the supply chain, and just this week we have again pushed WHO to say more, but also manufacturers need to step up with the supply of protective equipment. There are other really important issues for nurses as well, that they get rest breaks, they get support with the psychological pressures and demands that they are under. We think we need much more testing of health workers as well. If health workers, if nurses get the virus, then not only does that mean that they're sick, but it reduces the capacity of health systems to respond. There's good guidance that we've supported WHO on again on health worker rights and responsibilities that sets out many of those issues. And we've also been engaging in some of the big policy questions in terms of how governments and the world is responding. I've been really struck and impressed by what I've seen in China and Korea and Taiwan as well, with the speed of response and mass testing. As a result of a lot of this work, we've had increased requests for media interviews and comments. We've taken that opportunity to share and reflect the reality that we know our nurses are experiencing day in, day out. But also it's a really rich source of experience and learning which can help to inform policy and countries to make the right decisions about how they respond to coronavirus. And the best policy will be policy that's informed by nursing experience, nursing voice, and nursing leaders. Of course, all of this is taking place in the year of the nurse and the midwife. But if we think about what the aims, the objectives were of the year of the nurse and the midwife, to raise awareness of nursing, to show the reality of what modern nursing is all about, to make the case for support and investment in the nursing workforce, then what's happening now in the response to coronavirus is the most powerful practical demonstration of that, of nursing in action. And of course, the other thing that this virus is showing the world is that the relationship between health and our national and global security are absolutely intertwined. Health is wealth, but health is also security for all of us. So we're going to continue with the work in relation to coronavirus. Please keep sharing with us your experiences, your stories, your case studies. We will share them, we will use them in our continuing advocacy and our campaigning work on behalf of the profession. Here at ICN, I and the whole team have been touched, moved, and left with an incredible sense of how proud we are of what you are doing. Together, unified in our international union, we are stronger than everything that stands in our way, even coronavirus. Thank you, colleagues.